Hello, Dr. Somechukwu. How are you doing, sir?
Good, thank you.
Viewers, today we still have Dr. Some with us. The last time he was here, he really dealt much on urinary issues and a lot of health topics. And today with me, he will be discussing peripheral vascular diseases. Doctor, what is peripheral vascular diseases in a layman's understanding?
Okay, thank you. Welcome, everyone. Peripheral vascular diseases. So peripheral, it's always good to explain them one by one. Peripheral, vascular, and disease. So peripheral means the outside. So central means going to the middle, and peripheral means the outside. So once we talk central in the body, we're talking about the brain, we're talking about the heart when it's in the vascular system. But anything beyond that becomes what we call the peripheral vascular system. So away from the heart, away from the brain. Then vascular. Vascular means, the tubes. We call them tubes or wires or things that take blood out of the heart or bring blood back to the heart. So, even our young age, when we're in primary and secondary school, we are taught about the vascular system, and we are told arteries are the vessels that take blood away from the heart, and veins bring blood back to the heart, and capillaries is where the arteries and the veins meet together. So, peripheral vascular diseases are diseases of the vascular system anywhere apart from the brain and the heart. And these diseases have been there time immemorial. They are more prevalent with increasing age. Thank you.
Yeah. Can you help us talk about the causes? Because it's very important.
All right. So before we get into the causes, peripheral vascular disease, this is a very big topic, and you could get many sections in this topic. But I decided to lump it together, hoping that within the limited time we have, we can talk through everything. So peripheral vascular diseases has two main. Remember, we said there are two blood vessels. We have arteries and we have veins. So in peripheral vascular disease, we have peripheral artery disease and we have peripheral venous disease. So in a nutshell, peripheral vascular diseases that occur as a result of a disease of the arteries are about 6% of them. Those that occur as a result of a disease of the venous system is about 70% of them. And those that occur as a result of a combination is about 15%. So you see, majority of it is as a result of the venous problem with our venous system. Now, the peripheral artery diseases, as we said, occur in vessels away from the heart, down. So starting from your aorta, which is the big blood vessels that takes blood away from the heart, and it's in the center of the abdomen, up to your iliac arteries, up to your mesenteric arteries. Mesenteric arteries are the ones that carry blood vessels to your bowel. And the iliac arteries carry it to the kidneys. And then you have the arteries that go down to your legs. The iliac arteries, you have the femoral, the popliteal, and before you get to your foot. This is for the arterial system. So for this arterial system, remember I said, about 5 to 6% of the peripheral vascular diseases occur due to disease of the arterial system. And these diseases of the arterial system occur with increasing age. And what we see is that there is some form of blockage. Sometimes it's cholesterol deposition in these areas. It could be from the inside of the blood vessel. It could also be from the outside of the blood vessel. And it could also be due to a change in the composition of the blood, which is flowing inside it, that could lead to a problem with this system. And it could finally be due to thickening of the blood vessel. Then the venous system, remember that's the second one. So the peripheral veins are these veins that take blood from the system, bringing it back to the heart. And they go all the way from your foot, coming up, back to your heart. And they go by different names, from the saphenous to the popliteal. So the veins are same name as the arteries. The only thing is that while the arteries take blood away from the heart, the veins bring blood back to the heart. Remember, the blood has to come back to the heart, and it comes back to the right side of the heart. And the right side of the heart has to pump it to the lungs. And when it goes to the lungs gives the oxygen that the blood needs. And then the blood now goes back to the left side of the heart. And from the left side of the heart, then it goes to your body, back to the arteries. So it's a closed loop system. So you're asking about the causes. So you can see with this arterial and venous system, many things could go wrong. But one fundamental thing is also that this system is a 24-hour system. Even when you are sleeping, your heart is pumping, you're breathing in and out, air is going into your lungs, blood is getting oxygenated. So as this is happening, just like the vehicle you drive on the road, there's wear and tear. So as your car gets older, you could tend to go to the repair shop more frequently. So that's why as we get older, we say, make the doctor your friend, because you need the doctor. You need to go more frequently because your system is now getting mileage. There should be wear and tear. So then what now happens is, like I said, increasing age is one risk factor, which unfortunately we can't change. Then other risk factors are also disease conditions. So if you're diabetic, what happens is that your blood vessels tend to thicken more quickly. If you're hypertensive, what happens is that your blood vessels are under pressure because your blood is pumping at a very high rate. So if with that high rate, there is high pressure as well. And because of that, there's more pressure on the blood vessels. And then other disease conditions, there are disease conditions that primarily affect the blood vessels. And there are also disease conditions that are neuronal in origin, that is from the nerves. And you know, these nerves supply these blood vessels. So when there's decrease in nourishment of the blood vessels, then you could have also peripheral vascular disease. And in the venous system, where most of it is in the lower legs, the other causes could be things like immobility. So if you're doing any job, especially if you work in an office where you sit down most of the time and you don't move around, please change that attitude. Try to walk around, even if you're standing up at your desk for a few minutes or few hours and then sitting down. That helps, because you can imagine a system where blood is going down and coming up, and you're staying at one point for majority of the time. What happens is that there's going to be what we call peripheral pulling. So blood is staying at the lower part of your body most of the time. And when this is happening, what happens is that you're putting those veins under so much stress. And with time, the tensile strength, which is the strength inside these vessels, will start giving way. And what happens is that they will start either expanding or not being able to function the way they function. One of the most notorious things that happen is that these veins have what we call valves. So like the valve you have in the car tire. So when they are under so much pressure, the valves tend to decompensate or become incompetent in medical language. That means they are not able to close completely again. So they close and there's some opening. So blood is now going to and fro. Remember, this system is a perfect system that blood is meant to flow one way. It's not supposed to go the other way. The arteries take it out, the veins bring it back. So it doesn't go up and down. And by the time it starts going up and down, then there is problem. You start getting swelling, and with swelling, which we call edema, that increases the risk of peripheral vascular disease and many other things that could come with that. So in a nutshell and in a summary, what could be the causes? Increasing age, disease conditions like diabetes, high blood pressure, sedentary lifestyle, inactivity or immobility. These are all the things that could increase the risk of you having a peripheral vascular disease.
Wow. Doctor, you have really dived deep into this topic. May I know the types? How many types of this disease do we have?
So like I said, there are two types. You have peripheral arterial disease for the arteries. You have peripheral venous disease for the veins. So for the arteries, so normally what we do is for both of them, we normally try to grade it. We say mild, moderate, severe, right? So that you have the arterial disease is mild, it's moderate, or it's very severe. That is, you definitely need treatment. And also for the venous system. And when we go to the diagnosis, maybe I'll explain further in details what we do and how we go about them.
Yeah, so what, I haven't said that. What is the diagnosis?
All right. Okay, thank you.
How do you diagnose it?
We'll start the arterial one. So peripheral artery disease, how do you diagnose it? So how you diagnose it is especially the usual thing. You take a history, ask the patient, what is he experiencing? So one of the common things people will tell you, people who have peripheral artery disease of the central blood vessels, like the aorta, which is the big vessel that carries blood from the heart, they complain of back pain. Back pain because this aorta comes out in the heart and it's at the back that it goes down. So people might just complain, doc, I have this back pain. It just comes and goes. So that could be a sign that they are having peripheral artery disease of the aorta, especially if it's a smoker. So people who smoke, we screen them for what is called AAA, abdominal aortic aneurysm, which is a disease of the aorta, which is the blood vessel in the middle going down from the heart. So that's one of the commonest complaints. This other one is for people who have peripheral artery disease of the legs. They complain of what we call claudication. So they walk, and when they walk a certain distance, they start having pain. And when they stop, the pain goes away. So that's what we call claudication. And this makes them intolerant to exercise. And that could make the person sedentary, so they don't exercise at all. For the venous system, one of the complaints, people may just complain of having ulcers on their legs, or they could complain of discoloration, so a change in color. All of a sudden, the legs are now black or turning red or turning other colors. So this could be some of the commonest things that could point to the direction of peripheral vascular disease. That is from the history of what the patient complains. And when you come, the tests that we do. So for the arterial system, we check the pulses. So you come and the doctor is touching some areas. He's touching your wrist, he's touching your legs, your ankle area to check if he can feel the pulse. Because when the blood flows through some areas in the body, we feel what we call the pulse, which is a sound. The doctor listens to your heart to check how your heart sounds are. Then the next thing is the doctor will do some tests. Common tests we do is what we call ABI, ankle brachial index. Ankle brachial index is we compare the systolic blood pressure of the ankle to that on the brachial artery, which is on your upper arm. So when we compare this, we try to see what the numbers are. The normal should be anything between 1 and 1.4. If you have anything below that, we feel that you have a problem. And if you have anything above that, there's also a problem. Lower, anything from 0 to 0.9 or about 1 for ankle brachial index means that you have peripheral artery disease. So that means blood is not flowing the way it should. Then, if it's more than 1.4, it means that your blood vessel is stiff. So it could be stiff because of disease conditions like I mentioned, high blood pressure, diabetes, and other conditions. So that's the first test that we do. And when we notice this, depending on the extent, the doctor might decide to do some other tests, also depending on your symptom index. So other tests they could do is ultrasound, what we call a duplex ultrasound. This is the kind of scan that looks at the inside of the arterial system. And then there are other tests like a computerized tomography scan, MRI, other tests that we can do. Now, for the venous system, we also check the veins. So we know the areas where the peripheral veins are prominent in the body. And we look at those areas to see any changes in the skin, and also we check for any ulcers. Notoriously, what happens where most people will have the peripheral venous disease will be along the saphenous vein, which is the vein that is in the inner part of the lower leg. So sometimes it's around the ankle area that these ulcers may be, or where they have this discoloration. Most times that's where it may start. So some people, I remember going to the village and somebody tells me, he has a chronic ulcer. And then he said, well, this is something he believes. Somebody told him they send this to him. In our local language, he called it a name. Achere, that's what he called it. And that means, it comes and it gets worse. And he believes it's something supernatural. So I had to convince him that, well, I think this is a medical problem. You can try the medical treatment. And then if it doesn't work, you can think otherwise. So I'm happy he sought medical help and the ulcer was healed. He was diagnosed as being diabetic and so on. So these things could be a pointer to a disease condition which you don't know you have. So that's basically in a nutshell and when we do the examine for the ulcers, for the venous system, then we can also do the same ultrasound, which is now a venous duplex ultrasound. This venous duplex ultrasound will tell us how the venous system is. In fact, it can even tell us if you have blood clot inside the veins. Because sometimes it could be because you have a blood clot which is stopping blood from getting to those distant areas. And so that's why you're
just to help us, because we are running out of time, how do you treat this disease? Does it have treatment?
Yes, there are treatments. So treatments are number one, you treat what is causing the peripheral venous disease. So peripheral vascular disease, whether it's arterial or venous. So most times peripheral artery disease could be because of high blood pressure or diabetes. So you treat it, you control it well to reduce the pressure of blood flowing in the vessels. The venous system, it could be because somebody is also diabetic. There's so much sugar in the system. It could be because they have a blood clot. If they have a blood clot, you might have to give them anticoagulation medication to open up that area. So this would be the main treatments. And then for people who medical treatment will not work, there are various forms of surgical treatment. Stenting, if it's for the veins, we have venous stripping, we have sclerotherapy. They can even burn off those veins because we have deep and peripheral veins. So there are alternatives or things that could be done to make sure that the problem doesn't continue.
So, doctor, because of our time, what would be your advice to the general public?
Advice to the general public is, our vascular system is very important to us because no one can live without oxygen, and this oxygen gets to the area in the body because the blood takes it to that area. So you need these vessels to deliver oxygen to the areas of your body. You need them to deliver the nourishment to the areas of your body. Peripheral vascular diseases could lead to you losing your fingers, your toes, your limbs. It could lead to amputation, which is you losing your limb or your digits just because you didn't take care of your vascular system. This is one thing. The other thing is the lifestyle that we live. Smoking is notoriously bad to our vascular system, so it brings toxins that attack the system. If you have disease conditions like diabetes, it's good to monitor, check your blood sugar. And also, if you have high blood pressure, it's good to make sure the blood pressure is controlled because these are the things that all put pressure in the peripheral vascular system. So the peripheral vascular system is a reflection of the nourishment that we're going to get. How healthy it is will determine the extent of the nourishment that you're going to get to especially your distal extremities. So it's good to take care of this. And if you notice any changes...
So, Doctor, thank you. If we leave you today, I know you have a lot to offer. Thank you very much. We are indeed very grateful for having you today in this program. Thank you for watching. We hope to see you next week in the same program, the same channel. Keep watching ACNN, the Pew and the Pulpit. Thank you and God bless. Hey, I welcome you to the Pew and the Pulpit, coming to you live from the Anglican Church of the Holy Spirit, Bronx, New York. The address is 3840 Seaton Avenue, off 233rd Street, when going towards the highway. And the address is, the zip code is 10466. 10466. Our email address is Anglican Church of the Holy Spirit at yahoo.com. Email us at Anglican Church of the Holy Spirit at yahoo.com. The phone to reach the church by phone, 929-944-3424. 929-944-3424. Come, we worship every Sunday at 11 a.m. It's just a 2-hour service. We are a live and happening church here in the Bronx, New York City, and in the center of New York City. And we are a welcoming congregation. We worship in English. All is welcomed, but we do not believe in gay marriage. So don't come expecting to be wedded in our church because it's not part of our tradition. We are part of CONAM. CONAM is Church of Nigeria Mission in North America. So we're a full-fledged Church of Nigeria Mission here in America. Come and be blessed. Thank you.